Hello, my name's Dr. Midwest, and what brings you in here today? Oh, I see. Yeah, I can see you did bump your head there pretty good, huh? Okay. Let me see what notes the receptionist made for me. Okay, and can I just have you verify your full name, please? Okay, and your date of birth? Okay, very good. And it looks like we didn't get your email address, so can I have that added to your chart? What is that? Okay, and is that at Yahoo, Gmail? Okay. Excellent. So can you tell me a little bit about what happened and how you got that bump on your head? Okay. Oh, I see. All right, well, it doesn't look like there was too much damage done on the outside, but I do just want to do some tests on you. It's a series of small little tests called a cranial nerve exam, and we'll just make sure that nothing was damaged on the inside, okay? Okay, it sounds a little bit scary, but it's not scary at all, I promise. Okay, so the first thing that I want to do is just get some gloves on and examine your face a little bit, okay? That glove was quite a struggle. Okay. Okay. Now that I have these on, I just want to make sure that I am seeing symmetry in your face, and that will go from your eyebrows, your mouth. Make sure that even all of your wrinkles are pretty symmetrical, okay? All right, so let me just look up close. Okay, good. All right, I see your tiny little smile lines look symmetrical. That's good. Can you just give me a big smile? Okay, perfect. And can you raise your eyebrows like you're really surprised? Good, very good. And can you just puff your cheeks out like a chipmunk? Like, okay, all right, excellent. Now what I want you to do is just hold your eyes closed really tight, as if you're in the shower and you're getting soap in your eye. I'm going to try to open them, and I just want you to resist that, okay? All right, hold your eyes closed tightly. Okay, good. All right, your eyelids appear to be nice and strong. And now if you would keep your mouth closed, I'm going to gently try to attempt to open it, okay? Okay. Okay, wonderful, great resistance. And then the final one that I want to do just to check the resistance is if you will hold your arms out for me. Hold them nice and strong. I'm going to push down on them, not too hard, but just try not to let me, okay? Okay. Okay, very, very good. Everything does seem to be in order there. I do want to give you a very quick and thorough eye exam, because the eyes are quite telling if there is something going on neurologically. Okay, excellent. I do want to go ahead and keep everything marked down here just so that we can send you your scores at the end of this. Okay. Muscle strength is good. All right. Now, the first thing that I want to do is I want to check your visual acuity. And I'm going to do a series of tests for that. I have a little eye chart for you. I'm going to test your peripheral vision, and then I'm going to have you follow the tip of an object as I move it around, just so I can track how your eyes are moving, okay? Okay, excellent. So the first thing that I want to do is use the eye chart. And it's just a simple, basic little eye chart like you might see at the eye doctor's office, but this is just a really simple test, okay? Okay, so I have this here, and I just need you to try and read the lines that I tell you to, okay? All right, so can you read line number 1? Good, easy enough, right? Okay, now can you read this line? Excellent. Line number 3 underneath. Okay, very good. And now what I want you to do is go ahead and put a hand over your right eye, okay? And I'm going to have you try to read some of this just with your left eye. Okay. All right, can you please read line number 2? Good. And line number 3. Excellent. And can you tell me what this letter is? Very good. Can you read line number 5, please? Okay, excellent. And are you able to read line number 7? Okay, very good job. All right, now what I need you to do, just uncover your right eye and go ahead and cover up your left eye, okay? And we're going to do a very similar thing. I'm going to just have you read this chart with that eye only, okay? All right, can you please read line 2 for me? Good, and what about line 3? Okay, excellent. And can I have you read line 5? Good. And line 7. Okay, excellent job. You did really good with the eye chart. That is very good. Okay. So your vision does seem to be fine. That is good. And the next thing that I want you to do is go ahead and do some vision tracking. So if you could, please keep your eye on this, okay? Not literally, just look at this, okay? And I'm going to move it around really slowly, and I'm just going to track how your eyes are moving, okay? All right, so remember, keep your head still and just focus on this. Okay. Good. Very good. Okay. All right. You're doing very good. All right, yes, and I see your eyes are tracking this just fine, going up and down. All right, now I'm going to bring it in from one side. Good. And I'm going to bring it right back. Okay, excellent. Very, very good. Now the next one that I have is designed to just test your peripheral vision a little bit. So what I want you to do is go ahead and focus right on my nose, and I am going to wag one of my fingers, and I just need you to tell me whether it is my right finger or my left finger, okay? Okay. Good. Excellent. Okay. Okay. Very good. Okay. Okay. Okay, excellent. And I just have a little bit more that I want to do to test your vision a little bit further. So what I need you to do is, again, keep your eyes just focused on my nose. I'm going to start my fingers here and pull them apart, and I just need you to let me know when they are no longer in your field of vision, okay? Okay. Good. 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 Excellent. Okay. Very good. Good. Okay, excellent. And now I'm going to do just the opposite thing, okay? I'm going to start with my fingers way out here and bring them to the middle. And then once you can see them, I need you to just let me know, okay? Okay. All right, let's begin. Good. 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 Excellent. Very good. 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 Very good. Good. Okay. Okay. All right. It does look like your peripheral vision is just fine. So far, I'm not seeing any signs of a neurological insult of any kind. The tests so far are good, but I do have some more little tests to go through before we finish out this exam. I will be testing your nose, and then the best one, your taste buds. Your sense of taste, really, but you know. And I promise that if we get through everything just fine, I have something sweet for you at the end. Okay. Good, good, good. All right, and next I do just want to examine your eyes just a bit. I am gonna have to get kind of close to you, and I do have this light here that I'm just going to use. I'm going to see how your pupils constrict and how they dilate, and then I'm just going to make sure that I don't see anything abnormal, okay? Alright, so I am going to get just a little bit closer to you, and I do apologize about my sandwich breath. Okay. Good. 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 Excellent. Okay, good. Okay, it's looking good so far. They are constricting really quickly, but they're not taking too long to dilate again. And this is just what we would want to see. Nothing out of the ordinary. Okay. All right. Very good. Very good. Okay. All right. And make sure that you just keep your eyes forward, okay? Keep focusing on this honker. Okay. Good, good. Very good. Okay. I'm sorry if the light is uncomfortable, but this is very important after a head injury. Okay. All right. Everything does seem to be fine though. Your pupils are constricting and dilating as appropriate. Okay. All right. Let me just go ahead and get that marked. Okay, excellent. So everything does seem to be fine with your eyes. There's nothing that I saw out of the ordinary. You got a normal or passing score for each of the tests. And as I mentioned before, we will get the results, the final results of the test emailed to you. But so far I don't see anything concerning. So the next thing that I want to test though is going to be your sense of smell. And I do just have several jars with scents in them. I'm going to run them underneath of your nose, and I just need you to identify what the scent is, okay? Okay, and they're all pretty standard scents that you should be familiar with. Okay, and just tell me your best guess. It's not a big deal if it's wrong, but I just want to make sure, okay? Here's the first one. Okay, lemon. Very, very good. Here's the second one. What is that? Coffee. It's one of my favorites. And what is this one? Vanilla. Very, very good. Okay. And can you identify this one? Cherry. Excellent. Excellent. So I do also want to test that you are able to breathe adequately and smell adequately through both nostrils. So if you would please just plug your right nostril, and I'm going to run just another scent underneath of your nose, and just let me know if you can identify it, okay? Okay. What is that? Chocolate. Very, very good. Okay, now you can go ahead and unplug that nostril and go ahead and plug your left nostril for me, okay? I have just one more scent for you. All right, and just see if you can identify this. Peanut butter. Good. And regardless of what you think about peanut butter or if you're allergic, that is just scented like peanut butter, so we won't have issues with that. Okay. Excellent. Perfect score on that. So the next thing that I want to go ahead and examine is your sense of taste. So I do have a few tester sticks, and I'm just going to place them in your mouth. I'm going to place one under your tongue, on top of your tongue, and then on each side. Okay? And I just need you to identify the taste for me. Easy peasy. Okay, so can you go ahead and open your mouth for me? This one's gonna go under your tongue. Okay. Okay, what was that? Chocolate. Very good. All right. This one is going to go on top of your tongue. Very good. Lemon. The next one I am going to just put on the side of your mouth, so if you can open that up for me. Blueberry. Very good. And I just have one final taster stick for you. So if you can open your mouth, I'm going to put it on this side now, okay? Okay. Do you know what that one is? Watermelon. Okay, very good. All right. So everything does seem fine with that. Next, I want to go ahead and just test your hearing, okay? And you haven't been having any kind of buzzing noise or other kind of auditory issues? Okay, good. We don't want you hearing things that aren't there, auditory hallucinations, that would be bad. Everything does seem fine so far, but of course I want to check this. So what I'm going to do is make a noise either into your right ear or into your left ear, and I just need you to identify which one it is, okay? Okay, are you ready? Good. Good. Very good. Okay, excellent. Next, I'm just going to whisper a couple words into your ear, and I just need you to repeat them to me so that I know that you can understand them, okay? Okay, are you ready? Relaxation. Okay, good. Cranial nerve. Excellent. Apple pie. Okay, very good. Microphone. Okay, excellent. Excellent. All right, everything is checking out so far. I just have a couple more tests for you. They are going to be really quick things. The first one is that I want to test your sense of touch, and so I'm going to touch one side of your face or the other, and I just need you to identify which side it was, okay? All right, and for this one, I'm going to need you to close your eyes. Okay, so just tell me if it's the right or the left side. Good. Good. Excellent. Excellent. Very good. Good. Okay. Okay, very, very good job. You can go ahead and open your eyes just for a moment. So next I am going to try pressing onto your cheek either with a soft cotton swab or a harder wooden stick. It's a little bit sharp, but I'm just going to press very lightly on your skin, okay? And I just need you to identify whether it is the soft object or the sharp object. Okay, now you can go ahead and close your eyes. Okay. Good. Good. Right. Okay. Okay. Good. Very good. Okay. Okay. All right. Very, very good job. You can go ahead and open your eyes. Everything does seem to be in perfect working order. You didn't have any issues with any of your senses that I saw. Let me go ahead and get this recorded. Perfect, 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 perfect. Okay, so all of that does check out. The last thing that I want to do is go ahead and check your heart rate and your respiration rate. I'm just going to use the stethoscope. When you first did arrive here, and the nurse got your vitals, she did say that your heart rate and your respirations were just a bit elevated, and that would make sense because I know that you did have a little bit of a traumatic situation, but it doesn't appear that anything's wrong, and hopefully you've calmed down a bit and you're in a state of relaxation. So I'm going to go ahead and listen to your heartbeat and your breath sounds, okay? Okay. All right, now I just need you to relax, and I'm going to listen to your heart first. Okay, excellent. It seems that has calmed back down. And now I am going to listen to your breath sounds. So when I tell you to take in a deep breath, just go ahead and okay. All right, deep breath for me. Okay, and another one. Good. All right, deep breath again. Okay, and one more. All right, excellent. I didn't hear any issues, no kind of flutter with your heart, and then with your breath sounds, there was no congestion or anything that would make me think that you were having an issue, and the rate does seem to have decreased to a normal level. So that is excellent. You have done a really good job and kept really calm and been patient with me. So as I promised, I do have something just a little bit sweet for you. I do offer these to all of my patients as long as everything checks out. And these are little Dum Dum suckers. So we have several flavors. This is cream soda. This is pineapple. This is mystery. And This is butterscotch. I personally prefer to take the mystery ones, but of course you can have whichever one you prefer. Okay, here, please. Okay, excellent. All right, well, everything does check out here. Like I said, we will email your results to you. You should get those within 2 business days. And if you want to schedule another appointment or check your balance, you can go up front back with our receptionist again, and she will be able to help you. All right. Thank you for coming in, and I am very glad that nothing serious seems to be wrong. I hope I don't have to see you back here again soon, but if you need anything, we are here anytime. Okay. Well, thank you for being patient with me, and thank you for trusting us with your health care. And go ahead and be gentle and take care of yourself, okay? Okay. Bye.